My name is Joe Arciniega. I'm on the National Governing Board of the Alzheimer's Association, which is a big job. It's a global organization, a leader in Alzheimer's research, but also in treatment and in legislation for people suffering with Alzheimer's throughout the world, specifically in the United States. But I'm also probably frankly, in my opinion, more importantly, I'm an Alzheimer's ambassador for District 28, South Texas, which includes Laredo, where I'm in, my community, but also San Antonio, the Valley, other parts of Texas. That's a responsibility that I'm happily take on because Alzheimer's does impact Hispanics 1.5 times more than non-Hispanic whites. Webb County, which is where I'm in, 95.5% Hispanic. In addition to being on the governing board of the organization itself, governing oversight, making sure that the organization is doing right by the community and communities throughout the country and the sufferers. But my role is primarily to make sure that our legislative leaders are paying attention. So it's not just about raising funds for research, which is important because Alzheimer's is one of the sixth leading cause of death in the United States, one of the only ones that does not have a cure. There are no survivors of Alzheimer's, but it's a particularly acute problem in this area of Texas. County by county statistics. Webb County, which is the county that encompasses Laredo and a great deal beyond, but not, Laredo is basically Webb County, is tied for first in Alzheimer's cases in the category in the state of Texas, and number 9 in the United States. Our problem is huge here. Our work is cut out for us here, but it's a responsibility that I feel very passionate about. But the sufferers here are significant, and I realize that, and I serve the community because of that. So we lobby, we work hard to get them to the government to give funds to the NIH to fund a cure. And we have gone, in the time that I've been working with them, from funding at about 500 million level to 3.7 billion level in the last 8 years. Great. But we need help with the people who are suffering right now with the disease. It is critical because I'm meeting with people on the ground, what we call our constituents. I'm talking to them about their problem. They are sharing with me their challenges, the things that aren't available to them. We have just now had treatments available that have just now lobbied for them to be covered by Centers for Medicare and Medicaid Services. I've been having a lot of conversations about this lately with scientists, doctors, community leaders. Those of us in the Hispanic and African American communities already have a lot of problems health-wise with, and I think clearly it has to do with our culture, right? It has to do with our food. It has to do with how we process, our culture and all of that. It's the same issue with heart disease, diabetes, cancers. We are challenged. However, Alzheimer's disease is a brain disease. Ultimately, it's a brain disease. There are people who are in our culture who have no problem, who are in families, so people think, well, is it genetic? There are people in families where 2, 3, 4 of them, of the family of 5, have Alzheimer's, 1 or 2 of them do not. There are marathoners, there are people who break those rules and get Alzheimer's. That's why we are working so hard at the national level and the global level actually, for research funding so that people can understand what causes this disease. I was one of the activists, protesting in front of the White House and protesting at CMS offices, among them protesting across the country. We're at such the early stages of what's happening with this disease, and that's why research is still so important. However, we still have people suffering on the ground. We still have people who law enforcement think are under the influence of drugs or alcohol. They're not dementia patients. So now we have successfully in Texas fought for legislation that says we need training for law enforcement to have them understand the differences between the two. We do have nursing homes that are still not trained in specific aspects of Alzheimer's and other dementia. And so they are ejecting patients who, like my father did, because he was too difficult. I was able to find another solution for my father, but there are too many people in my community who don't have those means. They have to go to work. They have to. What are they supposed to do? Those of us that are advocates and activists, to build support around them. You know, people in this community, Hispanics and African Americans, already have enough challenges with services and accommodations that can and should be made for them. That's how I feel about it, I guess. So I just met with the Webb County judge. I had an important meeting with the city leaders, the city council last week. You know, I'm a Hispanic, so I know. I grew up in this community. I do know this about us. We don't want to talk about this problem. We are not comfortable, and I think it's from respect for our elders. We inherently grow up with a level of respect. When I meet with a lot of constituents in Laredo and in South Texas, and they tell me, you know, I don't want to expose my aunt or my grandmother or my mother, in some cases my wife, because there's more cases of younger onset Alzheimer's. It's very frightening. But I don't want to subject them to being called crazy. Unfortunately, that means we are later to diagnose. We don't want to talk to our doctors about it. So what I'm trying to teach our community members is I'm saying, you need to be advocates for yourself. You need to say, I'm sorry, no, this is not just a normal aspect of aging. My 65-year-old mother is not old enough to have dementia. This is not right. So I think it's a combination of the challenges of us trying to educate our people and educate the medical community. So I'm meeting with neurologists, which there are not enough of in South Texas, in a community of over 300,000 people. So I'm working real hard to try to figure out with San Antonio, which is 2 hours away. A lot of people in Laredo think, well, they could just drive 2 hours to do that. Well, sure, for someone like me and most middle-class people, you could drive 2 hours. But for lower class and socioeconomic challenged people, I'm sorry, they're not going to do it. They won't have their loved one 2 hours away. It's not going to happen. We need the resources here, and we deserve them here. So I'm working with the two major hospitals here in Laredo. It's a lot of people who are very tight family oriented, and they're not going to expose their relatives to the indignities of being labeled with dementia, or the challenges physically of having a spinal tap instead of an easy PET scan. You know, these are things that we need to educate the medical community into, as well as work with our own community. We got to tell our community with Alzheimer's, you can't necessarily count on yourself to be the advocate, because you may not have that ability for long. Someone has to step up. You know, I did for my dad. And, you know, I've been very public about it. I'm a public person here, and I talk a lot about Alzheimer's, and I'm open about it. I go, you know, my father and I did not have a relationship. But when he started having this problem when he was 70, he didn't have anybody else. I don't regret it. It was 5 years. It took him 5 years to die from it. And it was 5 years of one horror after another. I couldn't even have imagined how bad it was going to get. But we walked all the way through it until the very end. And that is what turned me into an activist and to an advocate. It was after he died in 2015 that I just said, nobody, absolutely nobody should have to go through this. You know, I had a front row seat to how bad the services were. They were already bad in San Antonio, which is a major city, like the 7th largest city in the country. And then I had to bring them to Laredo, which is bad on top of bad. You know, we are accustomed in Laredo to not being really noticed. It's always been kind of a humble, under-noticed place in the state. But here's what's important about it. Laredo is a microcosm. The border cities, for sure, are becoming more and more like Laredo. Economically challenged communities are more and more like Laredo. It needed this attention. I was devastated when I saw the county numbers. The county numbers came out at the Global Conference on Alzheimer's, International Conference of Alzheimer's in Europe. And I saw them here. When the results came, county by county stats, and Laredo was #1 in the state of Texas, I was devastated because I was worried that people wouldn't want to pay attention to Laredo. When I got the Jefferson Award, when the Alzheimer's Association nominated me for this locally, I felt like it was an uplifting sign to a community that is going to be suffering significantly over the next 3 to 5 years. And I welcomed it for that. All of a sudden, I had state representatives, state senators, I had a national senator, Henry Cuellar, senator. Everybody was wanting to know what the heck is happening, Joe. I thought, all right, good for Laredo. We're working real hard. I think the city is working hard. Our elected leaders, I've been working with them for 8 years at the state level and the national level. They are co-sponsoring legislation, voting for funding. They are doing their bit. World Alzheimer's Day is September 21st. It's so awesome that Multiplying Good would pay attention to that, because it's a huge day throughout the world. And we are serving it in our own way by having that day a caregivers conference in Laredo, the very first caregivers conference in Laredo ever. We're having it in Laredo that day. And it's a conference that's going to bring together people from this community. So attorneys to talk about medical directives. The caregivers conference, we're going to have a lawyer there who's going to be talking to people about medical directives, how you want to set those up. So that's beautiful. We're going to have the health department there. They're going to talk about medical services, services to retrofit your home. It is literally a community gathering of services in that community specifically for caregivers. It's literally the people who are on the front lines facing this issue. And that's happening that day in Laredo on World Alzheimer's Day. So we're excited to be able to provide that service that day. People are suffering out there right now significantly. So how wonderful that Multiplying Good is giving this a focus.